Shalom, my sweetest friends. Hope you're having a beautiful day. It's question and answer Thursday. And the question is, does IFS therapy work on everyone? So my simple answer is it can. And does it always? Probably not. I am not an IFS purist, such as the founder, Dick Schwartz. I think he would call himself an IFS purist. It's really all he does. I find myself using IFS, EMDR, some CBT, motivational interviewing, narrative therapy, but the two predominant modalities that I use are IFS and EMDR. IFS is definitely more of the theory that I follow and along with the practice. But I do use bilateral stimulation as a part of the work that I do, along with ketamine-assisted psychotherapy as well. So I am not a purist when it comes to therapy. However, I do think that the more skilled clinicians in IFS probably can treat just about everyone using the IFS modality. There may be a couple of diagnoses that would be more challenging, such as schizophrenia or psychosis, NOS. Those are the two that I would think would be most difficult, and it probably would need a very skilled clinician, such as the founder, Dick Schwartz, some of the solo lead trainers who have been around for a long time. They're the ones that I would probably think would be able to still work with people, even with those diagnoses. All that to say, the reason that a more skilled clinician is going to be able to use IFS in probably a very helpful way for most people is because they have a deeper understanding of how parts and self work together and how to use their own self-presence to lend to the client to be able to help them facilitate work. The same thing is true, though, I would say, with any modality. Almost any modality, the people who are at the top of that modality can probably use it with just about anyone. I would say the same thing with EMDR. I think EMDR could also be used with almost anyone as long as the person who's using it knows how. And I would venture to guess, like I said, that that's true for probably any modality. So does IFS work for everyone? Probably not every single person. However, the more skilled the clinician, the more likely that they will be able to use it with almost everyone. And I think that's true for almost any modality. So what I would say is, if you're questioning whether or not a certain modality will work for you, maybe try and see a more senior clinician, and they will probably be able to help you move forward using that modality if you really like that modality and it works for you, but you're feeling stuck. Those are a couple of thoughts. I hope it's beneficial. Hoping you have a beautiful day. Take care of yourselves and take care of others.